all of these things, if it's still not controlled, then come back and see me, and we may do an injection then at that time.
I got you.
Cool? So I'm gonna summarize where I saw the pain last time. Severe tenderness palpation to the right, second submetatarsal space, which is right here.
Right.
No hypermobility to the first ray. Gastroc equinus noted, but there was a lot of tenderness there. Second toe did not have deviation. Skin was dry, scaly. It's still kind of dry, scaly today. Mild laxity on the second metatarsal. When I stressed the second toe, there was some pain. Okay, so let's take a look at what it looks like today.
Okay.
And it's just the right foot, is that right?
Yeah, it's just the right foot.
So most of the pain was like right here.
Yeah.
And how does that feel today?
It's okay.
Not bad. I mean, you had a lot of pain last time.
Oh, it did hurt. It was like piercing.
And so there is some laxity there when I do that Lockman's test.
There is like,
is there some pain when I do that?
A little bit.
Okay.
But it doesn't hurt, but it's there. I can feel that.
Yeah.
It's not normalized completely. I can say
Any
that.
tenderness in between here?
No.
Okay,
No.
good. Any tenderness with this?
No.
Tenderness with that. No tenderness with the Mulder's click. Mild pain with the Lockman's test when I kind of push it up a little bit. Okay, gotcha. And then how's this here?
I don't feel it's okay.
Okay, good.
Never had anything at the back there. It was more so on the front there.
Well, it was always tight here.
Oh, it was?
Yes,
Oh, okay.
that's why this was. I think that's what's happening, because you don't have like a lot of ligament, like laxity here.
Okay.
And you don't have a hammer toe.
Okay.
Okay, these are some of the reasons why people end up getting this pain here.
Okay.
So it's good that you don't have a callus here. It's not too loose, I would say.
Okay.
So you don't have like underlying reasons of why you would get this metatarsalgia type of a pain.
Okay.
So that's why I think that we can probably get rid of this and make it go away and be like, goodbye.
Yeah.
Okay.
I wish.
What I would do is, instead of doing the Medrol pack, let me switch it up. You can take this other medication for like the next couple of days or week. Okay?
Completely. With the recommended one.
Yeah.
Okay, I will do that.
Okay. But the thing is, you can also take this medication as needed.
Oh, it is. Okay.
Yeah, as needed. So it's like an anti-inflammatory.
Great.
Okay.
Okay.
The other thing that I want you to do is called the Dixie Cup method. But you have to work on two things for me: the stretching of the Achilles tendon and the Dixie Cup method.
Sure.
If you do the Dixie Cup method, you may not even have to take any oral medication. Okay.
I will definitely.
And the other thing is, like, you don't have a lot of issues today.
Okay.
But another thing that you can do is taping. Okay. So basically, you take a piece of tape. Okay, it's called the figure 8 taping method for this issue. And then you cross it over.
Okay.
As you want that toe to sit a little bit down.
Oh, is that right?
Yes. So that it decompresses that area and doesn't put too much pressure there.
Oh, okay.
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 So, I mean, this is
and
just.
leave it for how long, doctor?
So you can do this daily.
And leave it like that for how long?
For the day.
Oh, for the entire day?
Yeah, you can do it if it stays.
If it's okay.
Yeah.
Okay.
If I do it, I always have like a skin glue that I do it, and then so that helps to keep it on there.
Okay.
But if you're gonna do this, I'm just giving you additional options.
Yeah.
And then when all these things don't work, and you're like, listen, I did all of this, I modified my shoes, I am doing the inserts, I'm doing the icing thing, I'm taking the over-the-counter anti-inflammatory as needed. All of these things, if it's still not controlled, then come back and see me, and we may do an injection then at that time.
I got you.
Cool? Any other questions?
No, I think you've given me a lot of options, so I'll definitely try to work at least 90% of them.
Thank you so much.